A 45-year-old woman comes to the office because of a 2-year history of an uncomfortable burning sensation in her feet. She says the sensation occurs most often when she's lying in bed at night and increases if the sheets touch her feet. The patient has poorly controlled type 2 diabetes mellitus and diabetic retinopathy. Her medications are insulin and metformin. On examination, distal pulses and cranial nerves are intact. Muscle strength is 5 out of 5 in the upper extremities and proximal lower extremities. Muscle strength is 4 out of 5 on dorsiflexion of the great toes. Deep tendon reflexes are 2 plus in the biceps, triceps, and knees and absent in the ankles. Babinski sign is absent bilaterally. Sensation to pinprick is absent up to the mid-calf bilaterally and intact in the upper extremities. Proprioception and sensation to vibration are intact over all extremities. A sural nerve biopsy specimen is most likely to show what in this patient? Please put your answer in the chat.
Can someone perhaps volunteer and indicate to the rest of us what your thought process was?
I see, neuropathy, I see diabetes. I feel like all the information on this question could go so many different pathways. But because I already saw at the end that we were going to see what does this show on a pathological level, I could kind of pigeonhole my viewpoint of what I needed to pay the most attention to in this big paragraph of lots of information.
We're looking at a nerve biopsy. What neurological changes on a pathologic specimen might you see due to that increased glucose that you could predict would be there? And then you would go to, okay, maybe because of aldose reductase, you're going to have increased sorbitol conversion from that glucose that could lead to damage to the Schwann cells, which would be present myelinating the peripheral nervous system. That was how I came to a conclusion of a lack of myelin on this peripheral sural nerve.
I 100% agree with Zach. Also, the moment that I read poorly controlled type 2, in my head, I was like, this is something related to glucose and it's not under control. Already have retinopathy. So that's another sign that I should look for an answer choice that is related to glycosylation of some part of the nervous system. And then I love that the sural nerve was actually in the question stems, because maybe I wouldn't remember my dermatomes, but thank God the question actually point towards sural nerve. So that really helped.
I think the biggest thing for me was just making sure that I wasn't going to fall for confirmation bias too quickly, I think, for that one. Because it was almost so obvious on the diabetic part, I wanted to just make sure that it couldn't have been hiding things. Are there any signs that could be some type of impingement or different things like that? But then it just kept going with poorly controlled diabetes, like diabetic retinopathy. Once the whole thing, it didn't really hint to anything else. That was when I was confident in saying it's the non-enzymatic glycation or glycosylation.
With the diabetes and the question stem, I was just immediately thinking towards more of a lack of sensation.